I want to say a little bit more about the senses in charge and sensory deficits. You'll hear a lot more about some of this later on, but I just want to really emphasize that children with charge are not just hard of hearing, they're also hard of vision, they're hard of balance, they're hard of smell, they're hard of touch. All the information coming into them is different. And that means that their experience of the world is very different. With sensory losses, you're going to get different development. So all the early motor milestones, think about fix and follow, head control, crawling, sitting, standing, walking, they're all vision-based and affected by balance. Why do you do those things? You see something that you want to get at. If you don't see it, where's your motivation? So the world is experienced differently. All the language milestones are affected obviously by your hearing loss, but it's not just how much hearing do you have. It's what's your hearing like with the aids on? Is it fluctuating? Does it get better and worse with ear infections? That kind of thing. And with vision, are you seeing the person who's speaking to you or signing to you? So the amount of vision and hearing you have is going to affect your communication and your language milestones. And as I mentioned before, learning that is incidental, not taught, but just sort of picked up in typical children has to be specifically taught to those with sensory deficits. So they're not going to see things and observe the reactions in the way typical children do. And so there are a lot of things you're going to have to specifically pay attention to and teach them. And that is true of all children with sensory deficits. And a little bit about that and deaf-blind. I mentioned the term deaf-blind early on. When you hear the word deaf-blind, you kind of think dark room, no sound. That's not really what it is. Deaf-blind is an educational term that refers to any child with some hearing loss and some vision loss. Most children who are considered deaf-blind have some usable vision and or some usable hearing. So if you have someone that's completely blind, you teach them with sound. If you have someone who's completely deaf, you teach them visually. If you have less hearing and less vision, neither of those approaches is exactly right. You need a different approach, which is deaf-blind. And a term that we use in the charge world is the communication bubble. And the communication bubble is how far out and how well can the child see, and how far out, how well can the child hear. Anything outside of that bubble might as well be behind them in the next room, not exist. So you have to figure out where they can get information, where they can access the information and present information to them in that bubble. And children find their own bubble. These are pictures of children working within their bubble. And you can see that they're working very close up. They're exploring with their hands. They're doing things that are getting things within their realm of experience. And figuring out where that is for these kids is really, really important. And a related issue is, I want to show you this chart of the physical influences on development in charge. And this was something developed by my mentor, Dr. Sandra Davenport, who is a pediatrician, medical geneticist, and deaf-blind expert. And what she was trying to think about is what all's going on with these kids. On the left-hand side of this are the external things, the senses. How much can they see? How much can they hear? Can they smell anything? Can they taste anything? How is their experience of touch different from other children? On the internal side are all the things going on in the body. Swallowing problems. Okay, they may have a cleft palate, they may have cranial nerve problems, tracheal or esophageal problems that are going to affect their swallowing and make eating a particular chore, even swallowing their saliva. Breathing issues. with choanal atresia, problems with their larynx and their trachea, cranial nerve abnormalities, reflux, all kinds of things affecting their breathing. Many of them end up with trachs because of their breathing problems. Mobility, how well can they get around? They may have limb anomalies. They've almost certainly got vestibular problems and low muscle tone, and that's going to affect how well they can get around. It's also going to make them tire very easily. And that fatigue is also affected by illness. When you're sick, you just don't feel like doing anything, you can't learn, and there's lots of reasons for illness with these kids, including pneumonia and ear infections and poor immune system and all kinds of things. Hospitalizations. We don't expect any development while they're in the hospital, but that's going to also make them tired. They may have a heart defect that was fixed enough that it works, but maybe it's not a normal heart, and so they're going to tire very easily. And all those sleep problems I mentioned, they may not have had good sleep. That's all going to contribute to fatigue. It's very tiring to have charge syndrome. It's hard to get through a whole day. So these are all things that are that sort of tell me that they're experiencing the world differently. And we need to be aware of that when we're thinking about what our expectations of them are. So I really encourage anyone that's working with someone with charge to get to know that child. What's her vision status? What's her vision bubble? What's her hearing bubble? Does it change with her health status or her aids or whatever? What's her balance like? What's her overall health? What kind of moods does she have? Observe really carefully. And you'll hear a lot about that from David Brown and Tim Hartshorn and Rob Last later on in this series. So observe them carefully. Work on communication. If you don't have communication, you can't do any of the other stuff. So communication, communication, communication. Well, is there anything that can help you get to know that child? Walk a mile in her shoes, or maybe I should say walk a kilometer in her shoes, but the US term is walk a mile in her shoes. I have learned that it is impossible to understand hearing loss and vision loss at a purely intellectual level. Deafblind simulation really, really helps. So I really advise people to do some sort of a deafblind simulation, and whenever possible, get all the people working with the kids, the therapists, the educators, the educational team to participate in a simulation. And over the years, I've come up with a really easy way to do this simulation. You can get some clear plastic glasses from your local novelty store, Oriental Trading Company, or put some tape on them to get a visual field loss, maybe smear them a bit with Vaseline or something to get some visual acuity problems. And then you go to a drugstore and you get some little earplugs. These they're little foam earplugs that you can put in. They're generally a 30 decibel hearing loss, which is considered a mild hearing loss and isn't even always aided. So think about being at that level of hearing without aiding it, and try it out. First thing you'll do is you'll be tipping your head back like the kids to try and see things, and moving around more to try and see things. And I recommend that people try to read something, pick something up and look at it and see how clear does the font need to be? How big does it need to be? What kind of contrast? Try to read something. See what you can see. Have someone present something to you and see if you can tell what they're doing at a distance. You can see who someone is, but can you see their facial expression and get feedback from that? Try and carry on a conversation with someone with this. So it's good to do it in a group. And what you'll find is it's exhausting. It's really hard to do. You have to concentrate to get the information in, both visual and hearing. And so it's a really good way to understand why these kids get so tired, why some of the behaviors happen, because it's hard work to get the information with all these sorts of things. So I really recommend doing a deafblind simulation.